How can we navigate new gene therapy treatments for lung cancer? Imagine a future where treatments target cancer at its very roots, fixing faulty genes or boosting the immune system to fight tumors more effectively. That future is becoming more real as gene therapy advances in lung cancer care. But navigating these new options can feel overwhelming, so understanding the current landscape is key. Gene therapy in lung cancer focuses on changing or replacing genes to stop tumor growth or help the immune system recognize and attack cancer cells. Researchers are exploring different strategies, especially for non-small cell lung cancer and small cell lung cancer, which are the most common types. One promising approach involves gene replacement therapy. For example, scientists have identified tumor suppressor genes like TUSC2, which are often underactive in lung cancer cells. Researchers are experimenting with delivering functional copies of these genes directly into tumors using tiny carriers called nanovesicles. Early studies show that this method can get the genes into cancer cells and turn off pathways that help the tumor grow, leading to potential tumor shrinkage. These are still in early trial phases but show promising signs. Another exciting area combines gene therapy with immunotherapy. In small cell lung cancer, clinical trials are testing gene therapies like Recorsa, which delivers specific genetic material to cancer cells, alongside immune checkpoint inhibitors such as Tecentriq. This combination aims to boost the immune system's ability to control the disease after initial chemotherapy. It's part of a broader effort to use gene therapy to support immune-based treatments, potentially improving outcomes for patients with extensive-stage small cell lung cancer. Researchers are also developing drugs that target the cell cycle, the process that controls how cells grow and divide. Some of these drugs inhibit proteins called cyclins, which are often overactive in lung cancer. By blocking these proteins, the drugs can selectively kill cancer cells while sparing normal cells. These targeted therapies are being tested in early clinical trials and could offer more precise treatment options in the future. Most of these gene therapies are still in the experimental stage, meaning they are being tested in clinical trials. Participating in these trials can give patients access to cutting-edge treatments and help scientists learn more about what works best. It's important to work closely with healthcare providers who can evaluate if someone is a good candidate based on their tumor's genetic makeup, overall health, and other factors. Staying informed about ongoing clinical trials at reputable cancer centers is a good way to learn about new options. But it's equally important to understand that gene therapy is not yet a replacement for standard treatments like surgery, chemotherapy, radiation, or immunotherapy. Instead, it often complements these approaches or remains an investigational option until more evidence is available. While gene therapy offers exciting possibilities, it also comes with uncertainties and risks, just like any emerging treatment. That's why consulting with experienced medical professionals is essential. They can help weigh the potential benefits and risks based on individual circumstances and guide patients through the complex landscape of new therapies. In summary, navigating new gene therapy treatments for lung cancer involves staying informed about ongoing research, engaging with clinical trials, and working closely with healthcare teams. These therapies aim to target cancer more precisely and may improve outcomes in the future. But always remember that personalized medical advice is crucial, and current standard treatments remains the foundation of lung cancer care.